coronavirus outbreak right now. This, as the United States Surgeon General calls this the most critical week in the nation's battle against the virus. As of today, Indiana now has close to 5,000 cases of COVID-19. The governor is set to talk with us just moments from now at the State House, and here he is. Let's listen in.
A few highlights regarding the 2-week extension of the executive order that I mentioned on Friday that was coming, that Hunker Down Hoosiers 2-week extension. First, let me just say that we've clearly listed in this executive order, this edition of it, all of the essential manufacturing operations doing business are done so with the health and the safety of every employee in mind. I want to thank everyone that's been doing that already to date. But we want to make sure all of those measures, working 6 feet apart from one another, making sure you're washing hands on a regular basis, making sure that there's hand sanitizer, et cetera, that all of that is available for every employee. All of that information can be found on the executive order, as I mentioned. Secondly, all retail businesses that are open outside of the list of businesses such as pharmacies and grocery stores and gas stations and convenience stores, all of those outside of that in regards to foot traffic will now operate just like our bars and our restaurants are doing. That's carry out, curbside, online delivery, potentially an appointment in a very rare circumstance. So there's no foot traffic inside of the facility going forward for all retail businesses. Third, all of our campgrounds, and that includes our state park campgrounds, are closed. We had those opened with good intentions in mind, but it was never meant, it was meant for our state park campgrounds, et cetera, for exercising. And we can't have parking lots full of hundreds of folks taking in our beautiful state parks. So they are now closed. That rare exception for a campground would be is if that is your primary residence. But those wouldn't be at a state park. And then let me just say fourth, and finally, before I kick it over to Dr. Box for her updates, Judge David Cook at the ATC will be overseeing all of our executive order enforcement efforts. This goes statewide, making sure all of these directives inside this new edition of the executive order are followed and complied with. He'll be overseeing personnel, law enforcement personnel at ATC, at excise, at gaming, our conservation officers. They'll be spread out statewide, making sure that we're all, again, orienting in the same direction, moving in the same direction, and going through this journey together. And with that, I'll turn it over to Dr. Box, our health commissioner. She's going to give us you've got a lot of updates and a lot of information to go over. But if you would please, in addition to whatever else you want to touch on, testing, our capacity, our PPE inventory and status, and then anything else you want to add.
Absolutely. Thank you, Governor. I do have a lot of updates today with some slides, so I do want to get started with that. And I am going to update you on testing in the state of Indiana as it stands now and future testing. We're going to talk a little bit about personal protective equipment, talk about ventilators and ICU beds as we go through all these slides today. In just over a month, our testing for COVID-19 in the state of Indiana has expanded with our addition of not only the State Department of Health lab, but Eli Lilly, IU Health, LabCorp, and Quest testing. As all of these labs have come on board, we have been able to significantly increase our testing. On April 5th, Indiana had the highest number of tests in one day. That was 3,548. The day before that, it had been 2,860. This is just a little bit below what we deem our maximum capacity to be right now, which is 3,700 tests per day. This has allowed us to expand our testing criteria, which I mentioned last week. in that we are including also our symptomatic pregnant patients. They've always been included in the testing, but are really underlining and underscoring the need to test any symptomatic pregnant patient because of their immune compromise. We also have included individuals that have high BMIs, meaning that their weight compared to their height is very high, and individuals that have underlying health concerns that are seen by clinicians if they're suspected to have COVID-19 should be tested. Since we have more capacity for testing at this time, we really are looking to our providers that are seeing patients in the hospital, in the emergency room, or admitting to make sure that they are testing for COVID-19, and especially these high-risk populations. By adding labs like MACL, Alverno, Deaconess, Quantigen, and potentially at Purdue, our hope is to be able to process more than 6,300 tests a day across the state in just the coming weeks. Although testing swabs and media remain a concern, I believe that we can reach these levels and are considering alternate ways of actually obtaining these swabs. We're also working to increase testing in northern and southern Indiana parts of our state, specifically for our first responders, our healthcare providers, our long-term care workers, et cetera, as we have been able to do here in central Indiana. More about that later this week. We've also had some questions about how Indiana's testing numbers compare to those surrounding states, and this slide shows you how Indiana's testing compares to testing being done in the state of Illinois, Ohio, and Michigan. Illinois and Michigan, as you can see, are testing about 460 individuals per 100,000 of their population. Ohio and Kentucky are testing about 373 per 100,000, and Indiana is testing 336 per 100,000. I also want to update you on the status of personal protective equipment here in Indiana. When we began planning for this pandemic, we calculated how many masks we would need if we could use our PPE to its absolute best, if we could protect everybody in the 100% fashion that we would like to do, not at the time of a pandemic, versus if we conserved as strictly as possible how we would be able to conserve our PPE. The best case scenario when we are using very strict conservation means that we would use about 50,000 masks a day, and that's with conserving. What we have received from the Strategic National Stockpile conservatively would cover about 13 days if the state of Indiana received no further supplies. That means that our hospitals were not receiving their normal supplies, which they are. They have noticed some slowing in receiving their supplies and some decreased amounts, especially more of our independent hospitals, but they are continuing to get PPE from their providers and their suppliers. We have currently distributed more than 80% of what we receive to hospitals and our local health departments. We have very limited supplies remaining for emergencies, and we will prioritize our hospital, our EMS, and our long-term care facilities with this. That's why it's more important than ever that you, if you have PPE, please donate it to your hospital, your long-term care facility, or to your EMS. If your business has the ability to make these products, then fire up your lines, because we're ready for it. And if you're not conserving the PPE that you have, the time to start was actually several weeks ago, but definitely start it now. As I've said before, the Strategic National Stockpile was never meant to actually be able to help every state in the United States with all of their PPE needs throughout the pandemic. Likewise, state health departments were never built to supply all the PPE needed in every hospital, every local health department, every EMS, every long-term care facility. We're not sure if we'll be receiving any additional supplies from the National Strategic Stockpile at this time. We are continuing to make requests through FEMA and will work to buy personal protective equipment anywhere that we can. But until I have those supplies actually in my hand, I cannot promise that we can replenish anyone's PPE. As a healthcare provider, that is incredibly hard for me to say. And I know that as a healthcare provider and a first responder, that's even harder to hear. But that's the reality that every state across the United States is facing at this time. This is just another reason for why we need every Hoosier to hunker down. We can't have you sick and in our hospitals and being carried in our ambulances or taking it into our long-term care facilities. Additionally, I want to update you about the number of ICU beds and ventilators and the work that we've done to increase the capacity for both across the state. As you saw today, the number of known cases has now topped 4,944 in our state, and 139 Hoosiers have lost their lives to this disease. We also know that nearly 1,000 people across the state are currently hospitalized with COVID-like illness. When we discussed the need for ventilators and ICU beds previously, we provided you some baseline numbers. With regards to ventilators, as of March 1st, our baseline showed 1,177 ventilators across the state in our hospitals for use. By March 30th, we had increased that to 1,927. As of today, we have 2,642 vents that are available and actually in our hospital systems to be used, with another 455 that have been identified for potential use if needed, for a total of 3,097 ventilators. Another way to show you the ventilator capacity is on this slide, and also it shows you the usage of ICU beds here in the state of Indiana. As of April 5th, 27% of the vents in our hospitals are in use, with 17% being used by COVID patients. With regards to ICU beds, as of March 1st, we had a baseline of 1,132 ICU beds in the state of Indiana. As of April 1st, that number had increased to 2,188 because our hospitals had done such an incredible job of converting every possible room into an ICU room. And by April 4th, that had jumped to 2,964, as you see on this slide. About 58% of those ICU beds across the state are currently occupied, and that about 60% occupancy rate has maintained very stable over the last week. Of those 58% of ICU beds that are occupied, 31% of those are occupied by COVID-19 patients. And lastly, today I have the unenviable task of informing you of a very serious outbreak of COVID-19 at one of our long-term care facilities. You asked me, and I said from day one what was my biggest fear as a state health officer, and that was that we would have an outbreak in a nursing home, like the one we witnessed in the state of Washington. Unfortunately, just like the state of Washington and Maryland, we here in Indiana have had a significant outbreak in a nursing home that has taken to date the lives of 11 residents related to COVID-19. This outbreak is occurring at Bethany Point facility in Madison County. The State Department of Health has been working with them since March the 26th, when they first requested our strike team to engage. On March the 27th, our strike team and a nurse surveyor visited the facility and tested symptomatic individuals. At that time, we confirmed 3 positive residents. We have had multiple discussions on that date and several after, and have been in the facility multiple times to discuss infection control, isolation, and to do further testing. Unfortunately, this situation quickly escalated. When we visited on Friday, we were informed that 20 residents were in isolation and that 9 individuals had died. Sadly, 2 more residents have died since then, for a total of 11 deaths. And unfortunately, 3 employees are hospitalized, 2 of which are critically ill. Our team is facilitating the transfer of asymptomatic residents from this part of the facility to another skilled nursing facility. Prior to that, on Sunday, we tested all residents in this particular part of this nursing home that the outbreak occurred, to make sure that even individuals that are asymptomatic, that we're testing them, if they're positive, they will remain quarantined in the facility and not go to another facility. This is a heartbreaking situation and illustrates what a brutal toll that COVID-19 can take on our most vulnerable populations. Unfortunately, this will not be the last outbreak of this kind. If you're a long-term care facility, please be sure that you are following the infection controls guidance. Please make sure that you're not letting your residents get together for meals or for gatherings. Please make sure that you're wearing a mask, that anyone that comes in contact with them or is making their food or cleaning their rooms or passing their meds wears a mask and washes their hands carefully. If you have ill employees or residents, take immediate steps to isolate them and reach out immediately to the State Department of Health. We will come out and we will test all of your symptomatic individuals. We will test other individuals that are in and near and live close to them in the residential facility. We will test any employee that appears ill. And we will make sure that you're following the appropriate infection control procedures and isolating these individuals. I can't emphasize enough that we're here to help you. It doesn't matter if we were there just yesterday, we will come again today. If the situation changes, we will come again and again and again to help you, because we know that you want to protect this population, and we want to help you to do that. These are our grandparents and our parents. These are our friends, our neighbors, our church relatives. They're individuals that we care about and that we want to protect. So please help us to do that. Thank you.
Thank you, Dr. Box. Fred, we'll turn to you now, the Commissioner of the Department of Workforce Development. You were asked a number of questions on Friday, and you were awaiting guidance. You want to share any updates that you have 48 hours later?
Sure. So today I'll talk a little bit about the CARES Act and our engagement with the U.S. Department of Labor. There are two specific provisions of the CARES Act that I want to talk about today. So I'm going to use some acronyms, but I'm going to talk about them separately. First, the Pandemic Unemployment Compensation portion of the CARES Act, or PUC. The PUC provides an additional $600 in weekly benefits to those who are eligible to receive regular unemployment benefits under state law. Over the weekend, the United States Department of Labor provided us guidance on how to proceed with paying these benefits. We've been working to quickly revise our systems so that these additional benefits may be sent electronically in the same manner as a claimant's current unemployment benefits are paid. The $600 benefit under PUC is effective as of March 29th, 2020, and payable for any week of unemployment through July 31st, 2020. All benefits will be paid retroactively to March 29th. The day the CARES Act was signed into law, our team here in Indiana worked to ensure that we signed all agreements to make sure that Indiana was at the front of the line when this act became effective, which was March 29th. And because we did that, that's why the payments are now retroactive, and we're able to take advantage of the entire length of time that this benefit is available. Now on to PUA, the Pandemic Unemployment Assistance portion of the CARES Act. This portion of the act creates temporary unemployment insurance, a program that's for individuals who do not otherwise normally qualify for unemployment insurance benefits, but who would be working but for COVID-19. This group includes those who are self-employed, independent contractors, gig economy workers, or those who have a limited work history. In addition to now being eligible for unemployment benefits, this class of workers will also be eligible for the $600 weekly benefit. The U.S. Department of Labor also provided guidance on this as well, and we're working to modify our current systems and create entirely new systems to cover this new class of eligible workers. There's a huge difference between modifying our current unemployment system or process to include the $600 federal benefit for those already eligible and creating an entirely new system for a totally new class of covered workers. Although we had already started working on creating and updating our unemployment processing system in anticipation of these guidelines, just like all other states, this new system, by and large, must be built. Multiple agencies will need to be involved, as we must have a way to systematically confirm earnings in a manner that our current system does not. To that end, the timeframes for implementation of the PUC and PUA programs will be different. Claimants receiving regular unemployment benefits should start seeing those payments hit the week of April 20th. However, we anticipate the new program under PUA for those self-employed, independent contractors, etc., to take a bit longer. We will provide more information on this in the coming days. On yesterday, we experienced a slowing down of our unemployment operating system due to volume. This prevented some people from getting into the system altogether, and for others, it created some call delays. We were able to address those systems and IT issues on yesterday. As it relates to calls generally, the unprecedented volume of claims and related calls are causing delays and problems with people getting through to talk to DWD staff representatives altogether. So last week I shared with you that we were hiring an additional 77 people to address this. We were also increasing some of our bandwidth. We began phasing in those new employees on today. Additionally, we've also contracted with a third-party provider to assist with our call center. Starting tomorrow, there will be an additional 100 people supporting us on a contract basis. This moment in time is unique and is presenting us with facts and circumstances that are changing rapidly. We're putting new systems in place in a number of days and weeks, when in normal times it would take months or even years to put these processes into place. That's why we must remain nimble enough to make sure that we can have the changes needed on a quick basis while providing system stability for the transfer of the necessary benefits to those in need. At this time, I'll continue to ask that you remain patient with us as we move forward in this process.
Thank you, Commissioner. Let me just underscore a point I made at the outset, and that's what we do today, what we do tomorrow is going to have a direct impact on where we find ourselves in 2 weeks from now. We need not look further than the East Coast to see, or the West Coast to see, how the wave is rolling across the land. And we project, as I said last week, that we're at the very beginning of our surge. And so it's incredibly important over this next 2-week period. You're going to hear me say a lot, this is the time. This is the time right now to be very mindful of our actions and of our inactions, quite frankly. There will be consequences for both our action and our inaction. And so that's why we're pleading with you, asking you, even enforcing the behavioral changes that we're putting out across our state, because it's all for the common good at the end of the day. And just remember that we're all on this walk together, we're all on this journey together. We'll call it a Hoosier hike. We got a Hoosier hike ahead of us for 2 weeks, and the good news is we have this in us. I'm seeing it all over the state of Indiana. There are so many good examples of people who are putting their neighbors, their community, our state ahead of their own, maybe immediate, what used to be of an interest to them. So thank you for everyone. We need not look further than the youngest among us to see some of the most inspirational stories. So I'll put out a few shout outs, a few thank yous to some folks who are at their beginnings. There's Sophia, who is a kindergartner at St. Thomas More in Munster, Indiana. She has been painting pictures to be posted in ICU rooms. And she's even convinced her fellow classmates to do the same. She said, and I quote, "It would be an act of service during Lent." Did I mention that Sophia was a kindergartner? I mean, come on. There's Dylan, who is just south of where we find ourselves right now, down in Center Grove High School, who figured out that so many of his neighbors and his classmates' neighbors were homebound, couldn't get out for good reason, playing by the rules. And so they're doing home deliveries. They even have a website where you can go and check what you may need, featuring local businesses. So it's as easy as ordering over the phone or online to support your local community. And Dylan's figured out a way to connect the supply and the demand. And then there's Nora, who is a precocious, theatrical 5-year-old that many parents could probably relate to. She's from down in Boonville, and I'll quote Nora. She said, "So I just found out will have to practice social distancing a little longer, and she did that in air quotes with her fingers. Let's talk about social distancing, because some people don't get it. On Nora's hit list is, you know, grown-ups socializing with their friends and dinner parties and playgrounds where people are going when they don't really need to go. She said, "I love Target as much as everybody else, but browsing the dollar section is not essential business. This is not the time to chat up Susan at Target." She even offers us some suggestions on what to do during a time like this, suggesting reading books and taking a bubble bath or binge watching some Netflix. I got to tell you, I shared this Nora story with my wife over the weekend, and she said she can't wait to take Nora to a Target, and it will be a super Target when it is responsible to do so. And I can't wait to give Nora a hug and say thank you in person. These are the examples. They get it. They're with the program, and we need to follow their lead sometimes through the eyes of a babe. So with that, we'll open up the lines and take any question that you might have. We have the whole task force with us again, and open up the lines.
Brandon Smith, Indiana Public Broadcasting.
Good afternoon, Brandon.
Hey, Governor. So I'm hoping to get a little clarity regarding the extension of the stay-at-home order as it relates to sort of only buying what's considered essential when you go to the store.
Yeah.
How are we enforcing that?
Yeah. My general counsel is stepping up. He and his crew are here. They spent the entire weekend making sure every T was crossed and I was dotted. You want to talk about distinguishing between what is and what isn't?
Yes, my name is Joe Herons. I'm general counsel for the governor. And as the governor mentioned, we have created a new category in the new executive order that goes into effect tomorrow night at 11:59 p.m., category called retail business. And to understand what that means, we have a category. The first category is our retailers that provide the necessities of life. So think about food, think about medicine, think about office supply stores that allow people to acquire office supplies so they can work from home and continue their jobs from home in this crisis. Think about transportation companies. So you have this first category, necessities of life, that really enables those operators to continue operating pretty much as they are today. And what I mean by that is customers can still go inside the store to shop, they can pay and they can leave. The second category we've created are called retailers that do not provide necessities of life. So think about florists, bookstores, think about fabric stores, craft stores, beauty supply stores. These things are not necessities of life, but we've created a category that allows them to continue operating under new conditions and restrictions. Specifically, the inside of the store has to be closed to customers. Customers cannot come into the stores to transact business. The way they would have an opportunity to continue in business is through online ordering. It is through call-in service for curbside pickup and delivery. And so that is the second category. So those are the two categories that we've created that we believe will provide greater clarity and understanding as people try to decide where they're going to shop and how they're going to shop going forward.
Thank you, Joe.
Steve from KPC Media.
Hello, Steve. Good afternoon.
Good afternoon, Governor. How are you doing today?
Very good. Thank you.
My questions are actually for Dr. Box, so I apologize here. Dr. Box, two quick things. I was very interested in your information about testing and our capacity here. First, I wanted to follow up on a question that I heard at the beginning of last week on whether Indiana has access to quick turnaround tests or if we're still primarily using the 24-hour kind. And as well as that, with the capacity numbers that you mentioned and the ability to perhaps increase upwards of 6,000 tests per day, the number of new cases that we're seeing, 500 or so per day, do you think that's an accurate picture of what's out there, or is that really a limitation of our current ability to test?
I think our testing definitely limits us knowing how many individuals in the state of Indiana are sick. I think we're not alone in that. I was on a call last night with the state health officers from all of Region 5, which is Wisconsin and Michigan and Ohio and Illinois, and we were all discussing the same issues. And all of us were talking about how Ohio State does 1,500 tests, or IU does 1,000 tests for us, or Lilly does X number of tests, and Cleveland Clinic does X number of tests. We're all kind of Band-Aid patching it together to get as many tests done as we can. You asked specifically, I think, about point of care testing, and I was hoping that we were going to, at least we were originally told we were going to get 15 point of care test machines from FEMA, from Abbott, and recently got an email at the end of the week that said that would be 5 machines. So I don't know when I'll get those. When I do, I know that each machine will come with 1 cassette that allows us to test 100 people, and we've already tried to jump on it and order those cassettes ahead of time, and they're already on back order. So no, I don't have any quick 10, 15-minute turnaround test.
Sherry, the Indianapolis Star.
Hello, Sherry. Good afternoon.
Hello, Governor, and hello, Dr. Box. Thank you for taking my question, which is actually 2 for Dr. Box. Dr. Box, I wanted to clarify. You mentioned that now people with elevated BMIs would be eligible for testing. Isn't that about 2/3 of our state? Or is it only the most obese people, number one? And then number two, with the numbers that you're seeing in terms of where cases are going and where what our availability is in terms of ventilators and ICU beds, is the hardware the resource that you're most concerned about, or kind of the peopleware of having sufficient numbers of healthcare workers to care for someone who needs to be on a ventilator?
Right. I think that those are excellent questions. First of all, the BMI of over 30 would be morbid obesity. And so even though we are a fat state, I think that we're the 12th most obese state in the nation, not everyone will qualify for that higher BMI. But that goes hand in hand with the higher incidence of diabetes when you're that heavy. And that really does put a lot of pressure on your chest with regards to breathing. So I think that's what we have seen with individuals that have not done well, specifically oftentimes younger individuals that don't do well. When we look at it, is that diabetes and the weight can be complications. Sorry, the other part of your question was?
Was whether you're more concerned about having sufficient hardware than kind of peopleware.
Yep. I'm concerned about all of them. I have a lot of Hoosiers that have stepped up. I think our volunteer line has been 1,400 individuals now. We have over 300 medical students. The medical school is graduating their 4th-year medical students early, and we've had 300 individuals that have volunteered that will be helping. Our nursing students have volunteered. So I do feel like we have some less experienced, but definitely good hands that can be made a part of a team and work as a part of a team, and that's what we're already seeing our hospital systems do. The PPE is a concern, but I believe that the federal government is trying to buy more PPE and to distribute that to states. We individually are trying to buy more, and I'm looking forward to the potential of potential people here in the state of Indiana firing up their manufacturing companies and maybe making us some PPE also.
Alexandra, Gary Post Tribune.
Hello, Alexandra.
Hello, Governor. Can you hear me?
Loud and clear.
Awesome, cool. Thank you for taking my question. I wanted to ask because in Northwest Indiana, there's been some confusion, specifically among craft stores, some closing, some opening just on the municipal level. So I know you released a new executive order today, but I was curious if the new executive order would make them essential or non-essential, and if you think craft stores should close sort of statewide.
Yes. Joe, you want to talk about Joann's Fabrics and Michael's and
Yes.
et cetera, et cetera?
Joe Herons, General Counsel for the Governor. To answer your question, the craft stores and fabric stores would be able to stay open, but under new conditions and restrictions, those being that there cannot be any customers in the store shopping and paying and leaving. They would have to conduct business, these operations, through online ordering and through curbside delivery as well as pickup. And so that would be the approach. They could stay open, but under new restrictions, and that is intended to limit customer interaction to reduce the spread of the virus.
Thank you, Joe. We understand that converting your business model is hard, but it's hard to give the daily reports, and it's hard to realize what's in store for us over the next 2 weeks. So drastic times call for drastic measures. We're all in this together. We're going to get through this 2 weeks, and we're going to look, I hope, on the past few weeks. Matter of fact, in the coming few weeks, that we did the right thing, each and every one of us. When I say we, I'm not talking about state government or local government or the federal government. I'm talking about all of us, we, the people. And we ask for your patience. And we ask that you do, in fact, if you want to, open your business for business, you're going to have to do it differently over these next 2 weeks.
Ken with the Associated Press.
Hello, Ken. Good afternoon.
Hello. This is for Dr. Box. In addition to the deaths at the Madison County nursing home that you mentioned, we're also aware of 3 deaths at a nursing home in Mitchell, Indiana. Are you aware of any other nursing homes that have had multiple deaths from the coronavirus?
I am aware of another nursing home that we reported on earlier that there was some discussion about in just a little bit south and west of the Indianapolis area that had multiple infected individuals. But those are the ones that I'm aware of. We are engaged in every individual nursing home that has any kind of an outbreak, as long as they let us know.
Andy, Fox 55 News in Fort Wayne.
Hello, Andy. Good afternoon.
Hi there. Thank you so much for taking my call.
Thank you for calling.
Yeah. Just a few quick questions for Dr. Box, if I may. The first, a handful of other states and cities are reporting a disproportionate number of people of color, especially African Americans, contracting the virus. Have you done a racial breakdown for Indiana? And if so, would you mind sharing that with us? Second, number of viewers report getting sick with symptoms of COVID-19 as early as the new year, leading many to speculate that it arrived undetected before testing really got going. Is that possible, and why? And finally, whenever we report a death, lots of viewers ask for the recovery rate. I'm assuming since mortality rate is between 2 and 3%, the recovery rate is between 97 and 98. And in your own words, can you tell viewers why that 2 to 3% should matter to them? Sorry, it's a little bit mouthful.
Okay. I have trouble keeping track of one of them. Yeah. No, the racial breakdown, we've been working very hard on that. The thing is, when you get the testing, we get a patient name, a date of birth, and we get an address. We don't get any other demographic information with regards to their race or their ethnicity. So we've been trying to go back through the BMV and to cross-match individuals, but we still got about a 30% gap in our data. So we're starting to ask our labs if they can put that racial information and ethnicity on the actual lab order so that we will have that information. Now, we'll get more of that as we look at individuals who are admitted and discharged from the hospital. That information will be available to us coming in the near future. Yes. Interestingly enough, as we look at our tests, we can start to see an increase in individuals who had pneumonia and potentially died of pneumonia or influenza-like illness in our state as early as we think as February. Because we didn't have any testing, there was no way to know exactly what was going on there. And the other factor that was very difficult with that is that we've had 3 waves of influenza this year. So we've had a particularly long year with influenza. So those are very difficult to sort out. But that is some of the data points that I've been looking at recently with my EPI team that they've pointed out. Yeah, the recovery rate is at least 97, 98%. And what I want to point out about the mortality rate again is that because our testing has been limited, we're only testing our most significantly severely ill individuals that have that fall into this high risk category. So all of those other individuals that had mild illness or minimal symptoms that we asked just to stay home and make sure that they got well and kind of quarantine themselves or isolate themselves for others, we will never know whether they were positive for COVID-19 until maybe down the line we'll have a serum test that we can do of their blood that will actually show that they have antibodies to show that they are now immune to COVID-19, and that will be able to confirm that they've had it.
Jenny, Wish TV.
Hello, Jenny. Good afternoon.
Hi. Can you guys hear me?
Yes.
Hi,
perfectly.
good afternoon. I'm sure you know, over the weekend, a church in Hammond was cited for violating your stay-at-home order. 30 plus people were inside, but church leaders say that they were essential. This is Holy Week in the Christian churches, states like Florida, Texas. They've declared religious services essential. Are you considering a change to the state's orders to allow services this weekend? And what's your message to pastors statewide?
I am not. My message to pastors is thank you for understanding that this Holy Week for many of us is the exact right time to connect with the Word and the truth. And the truth of the matter is that this coronavirus, COVID-19, does not discriminate. It does not care what crowd you're in. And we have to take every measure, every responsible measure to prevent those connections from occurring. And I'm so thankful that the pastors that are sending me their live streaming sermons and their messages of hope and perseverance and determination, and that we'll see our way through. I will tell you, this past Palm Sunday, those palm branches symbolized peace and victory as Jesus was entering Jerusalem and thrown at his feet. And we will see victory, we will see peace when we too complete our journey through this over the next few weeks, few months, whatever it takes. That's why I said we have this in us, but it takes all of us. And look, many of us are dependent on the church as a body, not as a building. So please, we're putting out this guidance for all of our goods. And you may unknowingly transmit this to someone that you've never met, know, or someone you love. And I don't think that's on anyone's heart. The way to prevent that from happening is to prevent yourself from being in large gatherings. That's why the CDC guidelines are so important. I was heartened that the Vice President Pence also put out word that they did not recommend, that the guidelines were not to assemble. As tough as this week, and there are other weeks, very religiously speaking, important weeks for other faiths throughout the year, this disease does not care. This disease will prey on the vulnerable. This disease will prey on large gatherings. We have it within us to prevent that.
Rob Burgess, Wabash Plain Dealer.
Rob, longtime listener, longtime caller. Welcome back.
Wouldn't miss it. Thank you so much. I appreciate it.
Thank you, Rob.
Dr. Box, I wanted to return to the testing numbers. We had 2 more cases in Wabash County reported as of this morning. According to the data, and thank you, by the way, for the increased breakdown on the data, the more kind of demographically, the better. There's also been 52 tests to date. Are all 52 of those, the results are back on those? And I know times are different based on the lab, private, or what have you, but how long, on average, would you say those 2 new cases that were reported today were tested for originally? And are these residents of the county or people who just work here and live elsewhere, or are they hospitalized there and they live somewhere else?
So we assign the positivity and the death of if an individual would pass away to the county of residence. And I can't really speak to the 2 that you're talking about as to where those tests went. Again, we are seeing still anywhere between a 5 to 10 to 12 day lag time with LabCorp and Quest because they're send-outs and they're working and doing testing for the entire nation versus the turnaround with Lilly, ISDH, IU Health here locally, and that is about 24 hours.
Nikki Kelly, Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Governor. I was wondering, Dr. Box, you mentioned obviously the need for PPEs and ventilators still. Has the state purchased any PPE or ventilators for this crisis?
We have ordered several PPEs. We have been given a significant amount of PPEs, which has been very much appreciated. We have not been able to purchase any ventilators with the concept that we would be able to get them in time for when we need them within the next 7 to 14 days.
Elizabeth, PBS, Michiana.
Hello, Elizabeth.
We'll come back to Elizabeth. Russ McQuaid, Fox 59.
Hello, Russ. Good afternoon.
And good afternoon, Governor. A couple questions. Do you have any frustration with other states that have not taken the measures that Indiana has in anticipation that we may beat this virus back here, only to see it rear its ugly head again early this summer because other states did not take your moves? And should Hoosiers expect that the stay-at-home order is going to last at least through May 10th, which would be Mother's Day?
I'm not going to assign responsibility to my mother or anyone else's. This virus does not care about holidays. It does not care about what day on the calendar. We'll be driven by the guidance of physicians and scientists, and we'll let the facts speak for themselves. That's what directs our decisions each and every hour of every day. Frustration might not be a word I chose, but I would just ask for everyone to be open-minded and enlightened by the facts on the ground, and we see how this spreads. This is not unique to America. This is global. This is a pandemic by definition, and we see proof positive cases where mitigation efforts have worked. And we see where ignorance or avoidance has not. And the more folks take measures to be safe, not sorry, after the fact, the better off we'll all be.
Sarah Clifford, Brown County Democrat.
Good afternoon.
Hello, Governor. Thank you. I wanted to clarify a couple of things. I heard you say that state park campgrounds were closed. Does this mean that you're keeping hiking trails and biking trails open at state properties? And also, Brown County residents are asking if visitors are allowed to be staying at rental cabins, tourist rentals like Airbnbs at this time. I know hotels and motels are essential, but what about those other types of businesses?
Yep. Joe?
Joe Herons, General Counsel for the Governor. With respect to the first question, the campgrounds are closed, obviously at public and private parks around the state. The parks themselves stay open. There is also a provision that says that if individuals who are living in an RV at a campground have nowhere else to go and for the time being need to stay there, that's an exception to the general rule that campgrounds need to be closed. With respect to the second question on hotels, the hotels and cabins, the prisoners or the inmates right now would need to go into correctional placement facilities if they're released from prison, or if they're released, they can always go to their homes if that's a safe environment.
She's talking about, I think, the hotels in Brown County for tourists and visitors.
Okay.
Hotels in general.
Hotels in general can stay open and operate going forward under the executive order. They are deemed to be an essential business, and so they can operate and continue to take guests going forward.
Lindsay Erdody, the Indianapolis Business Journal.
Hello, Lindsay. Good afternoon.
Good afternoon, Governor. I wanted to ask about the state budget and the status of that since we last talked about it. Curious if you guys have seen the March revenue numbers yet, or if you guys have identified any particular areas of savings that you could talk about, or given any more thoughts whether another revenue forecast is needed.
Yeah, I'll ask Chris Johnston to comment here, but we'll also, near the end of the week, be talking more, Lindsay, about our following phases, which will include our economic recovery steps to take. But Chris, you want to talk about how we're going to start seeing numbers come in for April and March?
Sure. We have just recently closed the books on March, and as I had said in previous releases, that we were anticipating seeing some impact already in March. But as a reminder, March's revenues really reflect the month of February, and so the month of April will really be the key indicator for what stands ahead of us. March, we did miss our forecast. This will get posted here in the next couple of days, but we missed our forecast by $70 million. But we are still ahead of our forecast year to date. So still in a great, not a great position, obviously, with what's ahead of us, but we're meeting that forecast through March. We have already started working with our agencies as far as looking at cost savings and other areas where we can hold back on expenditures because we do not know what the future holds. But as I mentioned, April will be that indicator. The other thing that we are working on is there has been 3 installments of federal relief legislation. The first was directly to the Department of Health, and they have started using that grant money already. The second installment dealt specifically with small businesses, the Small Business Administration, and the unemployment insurance that you heard from Mr. Payne. And then the last legislation that was adopted about 10 days ago is the CARES Act, and has probably about 40 different revenue streams, of which there will be assistance involving at least a half a dozen or more state agencies as far as providing assistance to those in need.
Thank you, Chris.
Whitney Downard, CNHI.
Hello, Whitney.
Hello, Governor. My question is actually for Dr. Box specifically. You talked a little bit about this before, having some influenza-like cases in February. How confident are you that we are capturing all of the deaths when it comes to COVID-19 even now? And, you know, are we consistently coding that across the state, or is that up to coroners in all of the different counties?
So it is up to coroners in all of the different counties, but we've had multiple times when we've sent information out to them. We've dealt with the Coroners Association, and they are very much looking for deaths that may be associated with COVID-19, just like they did with regards to drug overdoses. So they've been an incredible partner for us for this. Our hospitals are being very careful to make sure that they are also coding individuals that look like, based on their x-rays, based on their CT scan, even if they're not testing positive for COVID-19, to document their COVID-19 death.
Yeah, and please don't be seduced by the argument that COVID-19 is no worse than the flu. I'm not the doctor at the table, but I can tell you the volume, when you're talking about the flu and you're talking about a 7-month season, much different than the intensity of COVID-19 and the traffic that we're seeing in our hospitals. In New York, more people were admitted into the hospital with the coronavirus last week than had been admitted for the flu in its worst week, by a factor of 5. That's what we're trying to prevent here. That's the curve that we say that we're trying to flatten. This is not the flu. So I just don't want to, I want to make sure those wires don't get crossed. Yes.
Jeff Smith, WLFI.
Hello, Jeff.
Hello, Governor. Thanks again for doing this. Had a quick question for Commissioner Payne, actually, about exactly how far behind unemployment benefits are currently running.
Well, right now, we're on our 21-day process, and the last we checked, each one of those claims that have been filed within 21 days, we're in the process of making sure that they are out timely. And taking a look at, over the weekend, just how quickly those claims were coming out, we still are on track. So there isn't a huge backlog right now. So we anticipate that to stay. We hope it stays that way, and we'll continue to monitor it.
Cameron Riddle, WRTV.
Hello, Cameron.
Hey, good afternoon. Question for Commissioner Payne. Do we have an updated number on Indiana's unemployment rate? And then for Dr. Box, at the beginning, you talked about us running out of supplies in 12 days if we don't get additional supplies from the federal stockpile. So are you saying that Indiana, as a government, has exhausted all of its resources now and will need donations from any supply they can get? Can you clarify that?
Yeah.
You go first, and then you.
So I want to clarify that. I wanted to show you the amount in total that we had received from the Strategic National Stockpile in 3 different shipments. I wanted to show you that total amount, but to show you that related to our estimates for what we would need, if that's all that the state of Indiana got, we would run out within a period of just about 2 weeks. Fortunately, our hospital systems have already a supply chain from which they get a lot of their personal protective equipment, as do some of our long-term care facilities and our EMS. But the important thing to know is that even some of those independent hospitals have noticed a slowing in their supply chain, or maybe not getting quite as much. So the emphasis here is on the importance of being very, very careful not to waste our personal protective equipment, to make sure that it is being used by healthcare professionals and by first responders and long-term care facilities, and to have individuals that have this to please donate it to their facilities as we continue to acquire more.
And we'll, just a shout out and a thank you to all those Hoosiers who are converting their lines to, or their family rooms to make masks or face shields. These are Hoosier companies that have stepped up, and we will make those purchases. Fred?
So in terms of our unemployment numbers for the month of March, those numbers are not out yet. They usually are announced sometime toward the 20th of the month. Insofar as our weekly claims are concerned, we release those every Thursday. So this Thursday coming up, we'll release the numbers for the previous week.
Ethan Burks, WTIU.
Yes. Hello, Ethan.
Ethan, you should be able to speak. We'll circle back with Ethan. Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. 2 quick questions. Number 1 for you. Some states have, looks like they've been using their emergency alert systems to notify their citizens with changes in executive orders, Illinois, Michigan, New York. I wonder if you had any plans for Indiana to do that. And for Dr. Box, kind of going back to an earlier conversation, yes, this is a very holy week, and you have a lot of families that are going back and forth over whether they should even meet for Easter dinner on Sunday. In your professional opinion, seeing where we are, and this one looks like sort of halfway in that, that race to the surge, what do you tell them?
So I think that's a really good question, because my family's asking the same thing. You know, out of my family, there are only 2 of us that are now out in the public on a very regular basis for our work. Actually 3, as I think about it. One of the individuals works in a hospital. And the biggest concern is obviously that we bring it back to our family. So we will not be seeing my father, who's 88 years old, and we will not be seeing some of my other families that have members that have asthma and other underlying health conditions. We may get together as a very small nuclear family and have dinner together, but we really do a good job of social distancing even then. We were playing, you know, games on the computer together with my son that's in Philly and my brother that's in Pittsburgh over the weekend. So there's a lot of fun that can be had where you don't have to have all 24 or 30 of your family members together.
Abdul, we'll use every means and measure that we need to.
Our final question is from Michael at WBEZ.
Hello, Michael.
Good afternoon, Governor. Thank you so much for taking my question. My question is, as you know, a lot of people are losing their jobs and losing their income and looking at ways to cut back. One of the areas they may be looking to cut back is the cable or internet services to their home. If that's the case, how do you ensure people are getting proper instructions or kids through e-learning?
Well, the Department of Education is working specifically and directly with, and will continue to work with and through the Department of Education on those exact questions, whether it be remote learning or e-learning, to be able to accommodate in both circumstances. They're doing that every single day, the Department of Education, and we'll continue to support and work with them, those efforts.
Thank you for joining today's briefing. Governor Holcomb.
All right, you've been listening to Governor Holcomb's daily briefing. They'll be back again tomorrow. A lot to sift through coming out of that on this Monday. The governor says all retail businesses can remain open if they restrict sales to online or call in or carry out. That's new this afternoon. As far as the numbers go, almost 5,000 cases of COVID-19 across the state. The virus has killed 139 people, including 11 people at a nursing home in Madison County. We'll have much more on that tonight at 5 and 6. For now, though, All Indiana comes at you at 4 o'clock.
Use it to